Hi there, Sarah Peternell here with Family Nutrition Services. I am enjoying a beautiful Sunday here in Denver, Colorado, and I was just walking through my farmer's market, and it's just literally right outside of my door. We're so lucky and so blessed to be able to have this awesome resource, this local resource close by for fresh fruits and vegetables. I actually happened to bump into one of my clients as I was walking through the farmer's market, and she came up to tell me that she was pregnant. And I decided to record a video because I wanted to share my happiness for this client. She's a young woman, but she's definitely had her share of struggles with infertility. She and her husband had tried to conceive and had some issues and some pregnancy losses for about 6 or 7 years. And they came to me actually when they were finally ready to take the next step and undergo some infertility treatments at a local center here in Colorado that specializes in things like IUI and IVF and some of the more um, sort of medically geared protocols for fertility. I'll just leave it kind of that way. They had basically been told that they had a very low chance to conceive even with help. And when this couple first came to me, this woman was, really sort of upset, is kind of the only way I can really think of it, because she had been told to believe that her body was going to fail her, even though she had already experienced some losses, as I said, and had been through some really hard times in her family journey, and she desperately wanted to have a baby. She was putting her faith in the medical system to help her, but even then she had been told that despite the amount of money that they would pay, that she really didn't have a lot of hope. And I was disheartened by this information when she came to see me because honestly, it's not an unfamiliar story. I have had many clients over the years who, whether they're doing fertility naturally or they're maybe getting some assistance, where doctors base things on maybe statistics and odds that aren't really in the patient's favor. I would like to just say that from a holistic standpoint and from a holistic nutrition standpoint, doctors aren't doing their patients any favors by planting this seed in their head that women can't be successful to carry a baby. There are a number of reasons, obviously, why infertility may be a concern for a couple. Of course, there can be issues on the male side of things, so let's not rule out that sometimes it's not just a women's issue. But there are a lot of, health conditions for women that may be at the root cause of why they're having trouble conceiving. First and foremost, for my clients who have Hashimoto's or have hypothyroidism and low functioning thyroid, issues, there are root cause issues that are also affecting their fertility. These two things go hand in hand. So I have written some blog posts about miscarriages and also just like some of the issues surrounding hormone imbalance. These can be found on my website at sarahpeternell.com. So if you want some more of the details, do go there and read those blog posts. But what I just want to say today, for those of you who maybe are getting this type of messaging from your doctors that, we'll do our best to help you, but your chances are really low. Maybe it's based on lab work, maybe it's based on your medical history, maybe it's based on some, functional issue that you have, maybe only one ovary, or maybe you've had, endometriosis, etc. If you've been told that you can't conceive or that you have a very low chance of conceiving, I want you to remember that I bumped into my client this morning at the farmer's market after 6 years of infertility issues, trying naturally, and finally signing on to do IVF. She did conceive. She beat the odds. And the reason why is because she also started a complementary program to address her nutrition and lifestyle factors that were also playing a role in some of the reasons why she couldn't get pregnant previously. This woman does have Hashimoto's. She also has a secondary autoimmune condition. She had some serious digestive problems that primarily were irritable bowel syndrome-like, but really this was a pretty clear case of leaky gut and the autoimmunity that was arising from that. She had a host of food intolerances that we were able to address and lower the inflammation in her system. And she also had a number of nutrient deficiencies. So when she and her spouse had decided and they were ready to take the IVF journey together, they also made holistic nutrition a part of that. And those two things worked very, very well together. We were able to address some of the underlying issues for why her body was in the shape that she was in, right? She had malabsorption issues, she had inflammation, and she had nutritional deficiencies. Had she stayed in that state and gone through IVF, it is possible that she would have been unsuccessful because the body has to be ready. There has to be the right environment. There has to be a healthy and ready and low inflammation and really optimal environment in order for conception to take place. Your body knows if it's not the right time. So I was so happy for her. I gave her a big hug, and I just knew that for this family that they were going to have, that they did have a future with children. So when I saw her cute little belly and she told me that she was pregnant, it just made me so happy this morning. I wanted to share this with the many of you that I know are out there with a diagnosis of Hashimoto's or a diagnosis of another chronic condition or just a diagnosis of infertility without any specific reason, that there is hope. And I would ask all providers out there who are maybe saying things like you have a really low chance, or it's the odds are against you, or you fall outside of our medical model or our medical protocol of what we can do to help people. Please have your patients address their underlying health issues. Please have them look at nutrition. Please have them look at their micronutrient values. Have them look at leaky gut issues. Have them look at the food intolerances, which may be playing a large role. It is possible to get healthy, and it is possible to manage your health care and your health conditions with some basic nutritional and lifestyle approaches. And then combined with the miracle of medicine, right? Babies are made. So anyway, I was just super excited. Wanted to share that with you guys. And I do want to say, again, that I've worked with many, many families in the same situation, whether they're doing IVF or IUI or fertility treatments or just going the old-fashioned route. Because, right, a lot of people come to me after they've already tried IVF, and they're like, we want to give it another shot. Just doing things in the natural way. I just want you to know that it is possible. Okay, so I hope this leaves you with a really strong sense of empowerment this morning. And for more information on any of these topics and the more scientific information that backs up the body's ability to heal with nutrition, please do check out my website, sarahpeternell.com. Thanks for watching. Please like, subscribe, and share. Have a great day.